You twist, you turn, and maybe even stretch, but nothing makes it go away. We're talking about back pain, so common. What's causing the problem? Our first insider has some answers.
It really starts with walking upright. The mechanics on the back for those of us who are standing upright versus quadrupeds are quite different. And then the longer we're alive, the more likely we are to experience degenerative conditions. And those are very often painful. And then also active lifestyles can contribute to injuries. So there are a great number of reasons why people will develop back pain. And in fact, it's incredibly common. Second most common reason that anyone would go visit their doctor is related to pain in their low back.
In the lower back, yeah, of course. So do you find that it's due to like muscle spasms or sprains or anything like that, of that nature in general?
And the majority of the cases of acute back pain are just that, soft tissue sprains or strains. Sometimes it's as simple as just sleeping wrong. Sometimes it's from lifting, sometimes from overuse. But in general, most cases of back pain are related to the muscles and ligaments, and fortunately are self-limiting.
Gotcha. Well, back pain is so prevalent in the United States. In fact, according to the National Institute of Health, about 80% of the population will experience a back problem at some point in their life. Dr. Juliet Vento has more on when to see your doctor.
Most people at some point in their lives will experience lower back pain. When should you seek help from your doctor? If your back pain has been lasting more than 4 weeks, or if you're having other symptoms, like weakness in your legs or any kind of numbness or tingling down the leg, you should definitely seek the help of your doctor. There are a few non-surgical options that we can try in terms of back pain, depending on whether the back pain is acute or chronic. In terms of an acute back pain, we can try anti-inflammatories like the ibuprofen, naproxen, perhaps in higher doses. We could even try a low-dose course of steroids. We could try physical therapy also. And all of these are temporizing measures, and hopefully they'll get better with these. But if the back pain persists despite trying all of these conservative measures, then we definitely refer you to a specialist.
Dr. Vento mentioned to wait 4 weeks to seek medical care unless there are symptoms like weakness or numbness in the legs. What's going on if we don't have those symptoms?
Well, and that speaks to where we're usually dealing with a soft tissue type injury. Again, the muscles or the ligaments. And because those are self-limiting by nature and usually respond to conservative measures such as the passage of time, ice, heat, over-the-counter medications, massage, we really don't need to work people up. There's an over-reliance on imaging studies in the U.S., and a lot of people will have terrible pain for a day that'll be gone within a couple of days. So we end up having more X-rays, CTs, and MRIs done that are needed, and if we just allow a little bit of time and a little bit of easy treatments, a lot of this muscle and back pain isn't going to be over-treated and over-evaluated.
Right, so I guess it's kind of a tricky thing to do when you have a patient who's in extreme pain and they want something to be done right away. And at what point should someone go to the emergency room? I know you should look out for some of those symptoms, but when you're in that much pain, should it just be over the counter just to start off with?
Well, if the pain's truly intolerable, there are certainly no bonus points in this life for suffering. And if you can't get up out of bed or get up off the floor, then definitely that does warrant an emergency evaluation. And there are other things you'd want to consider. If this was related to a recent trauma, if there are significant neurologic symptoms associated with it, you certainly don't want to sit on that. But what we're referring to, and I believe Dr. Vento was mainly referring to, is that sort of run-of-the-mill ache in the low back. It hurts. It's worse when you bend over and when you're sitting. You feel a bit better when you lay back. Even if it's moderate pain, it will probably get better.
Gotcha. So rule of thumb is look for those symptoms that Dr. Vento mentioned, right? Just to make sure it's not something more serious than what you think it might be. Over-the-counter things like ibuprofen or other medications, is that okay just to start off with?
They are. I mean, of course, you want to check with your doctor if you have any other medical conditions before taking even over-the-counter medications, but in general, those are very well tolerated. One issue with the non-steroidals is they tend to upset your stomach, so you do want to take them with food, and you do want to, in most cases, take something to protect your stomach, an over-the-counter medication like Zantac or Prilosec or something else like that. Further to what Dr. Vento was talking about, if there are any what we call the red flags, severe pain, significant neurologic symptoms, any change in bladder or bowel function, well, those certainly do warrant going to the emergency department immediately.
Gotcha. So let's say you're taking some over-the-counter medications. You don't have any of the other things going on. It's just you got some pain back there. You know, we hear a lot that you really shouldn't take ibuprofen or anything for long periods of time. So here we're being told to wait 4 weeks to see how it responds to ibuprofen. Is it okay to take over-the-counter medications that long?
In general, for most people that don't have issues with their stomach, or issues with their kidneys, or some other reason that they can't take nonsteroidals, then it usually is fairly well tolerated. Anybody taking blood thinners should definitely contact their physician first, because there are interactions between the nonsteroidals and most blood thinners. And so it's not that we don't want patients to call us when they have this back pain, but they don't need to go through the ER. Very often it can be handled over the phone. And if there's any question, contact your primary care physician or see an orthopedist.
Gotcha. So at any point during this 4 weeks, let's say the pain's not, 2 weeks have gone by and the patient hasn't gotten less, the pain, would you at that point prescribe a steroid or just wait out those 4 weeks? Maybe up the dose of the ibuprofen a little bit? At what point would you need a bigger evaluation of the patient?
I think in general, we expect to see an improvement within the first week or so. So if somebody's not getting any better after that first or second week, then we're going to change what we do. Whether it's adding a steroid, perhaps a muscle relaxant or something else, or if the symptoms are giving any suggestion of progressing, then we may initiate a further workup, maybe get x-rays, even if normally we'd want to wait 4 to 6 weeks before doing so.
Gotcha. So in general, you normally want to get all these other tests done out of the way before you prescribe steroids, or not necessarily?
Well, not necessarily, because even in cases where you have something like a disc herniation, most of the time those will get better without the need for surgery. So somebody that has a couple of weeks of symptoms, whether they're just in the back or even in some cases mild symptoms affecting the legs, we expect a favorable recovery.
By the way, the doctor compared those of us who walk on 2 legs to quadrupeds, and that's just another way of saying an animal that walks on 4 legs. And that's our producer's dog. He's so cute. All right, so if you'd like to watch the entire interview with the doctor, just download our Health Channel app. And remember, if you have a question for us, email us by visiting our website, allhealthtv.com, or just give us a call, 855-796-4475.